Well, welcome to Psych Incubator and Eminent Psychotherapists Revealed. We are very pleased this evening to have with us Dr. Jeffrey Zimmerman. Jeffrey is a friend and a colleague who I've known for probably over 30 years now, and we're really going to learn a lot about practice. Jeff is a practicing psychologist in New York, Massachusetts, and Connecticut. He has been in practice since 1981. In addition to running and managing a large group practice for 22 years, he is the founder of the Practice Institute, TPI, guides mental health professionals in building ethically responsible, thriving practices by helping them learn practice management skills that serve as a foundation for the delivery of clinical services. Jeff has also focused on conflict resolution for over 40 years, helping for-profit and nonprofit organizations, couples, and divorcing families reduce conflict and achieve resolution when conflict appears to be irreconcilable. He is a frequent presenter and has taught conflict resolution and practice management techniques in both the US and China. He's a co-author and co-editor of multiple articles and books. And he's also the editor of Journal of Practice Innovations. Jeff, welcome to Psych Incubator, and thank you for your time tonight.
Well, thank you for inviting me. I'm excited to be here and look forward to our upcoming discussion.
Thank you.
Me too, and I'm hoping you can tell us how you got into this business as a start so we can understand where you come from.
Sure. Thank you, Michael. I always wanted to be in practice, even in graduate school. While that kind of had to be hidden in my program, that was a direction I knew from very early on, even in college, that I really wanted to always be in practice. And I started out in 1980 when I graduated in pre-licensure, working in a family mental health center in Connecticut, and then got licensed and began working in my own practice while I was working in a community hospital in Hartford at the same time. And in my practice in the 80s and early 90s, I was seeing a lot of kids with divorce. I was doing a lot of family work and individual work with kids and some adults. And what struck me with the kids of divorce was that I was kind of like sending an asthmatic kid home to their home when both parents smoked. And I would help the child cope with being in the middle of the parental conflict and feeling like they have to take sides. And if we had more time, I could tell you some very touching stories about that. But the kids would then go home and come back next week, and it would just be the same rinse and repeat pattern over and over again.
Like you were sending them back to the front in a war, right?
Yeah, very much. And some kids would actually use that metaphor. One kid used, I'll tell you a quick story, used the metaphor of, he said, Dr. Z, have you ever been at Gettysburg? And just before, a little while before that, I had been. So I said, yes. He says, you know, not the hill battlefield, but the flat one that's like a soccer field with two low walls. And I said, yes, I know that field. I don't remember what it's called, but I know that field. He said, well, it's like I'm in that field and mom and Grampy and grandma are on one side, and dad and Nana and Poppy are on the other side. And they're shooting at each other. And on that field, there was a wall about 18 inches high that you can imagine the blue and the gray, no shielding from all the bullets. And I, of course, said, and where are you? And he said, I'm in the middle on a horse trying to get them to stop. So he was taking bullets from both sides to get them to stop. And stories like that were very compelling for me. And I decided in the early 90s, I needed to research what other people around the country were doing for families of divorce and really get a good understanding of some alternative models besides just doing either psychotherapy. You couldn't really do family therapy because you couldn't get both parents in. And if you got them court ordered in, one would be sitting there like this, and they would be in the chair, but they wouldn't be participating. So I devised with another colleague a program where we we're not doing traditional psychotherapy, but we were hopefully being very therapeutic. And we were teaching parents about how to reduce conflict, how to communicate effectively with each other about parenting decisions, and how to make decisions even when they disagreed. And we also had to be clear about the values of the program and what those underlying values were as we spoke to judges, as we spoke to attorneys, as we stayed out of court by design, and how we did informed consent in that regard, and how we communicated with the other people who were all part of this network helping kids. And that's what got me started. It was really seeing the pain in these kids, and like that little boy telling that story. And it was actually a bit overweight. The straw that broke the camel's back for me to get me into this was an overweight little girl whose parents lived, they had divorced, remarried, and they lived back to back with each other, which sounds great, except she was alone. Both parents had other kids with their new partners, and she was the only child in this marriage. And she would go back and forth, and mom and dad wouldn't communicate with each other. And she was literally pulling her hair out and drawing pictures that were just so illustrative of what she was going through that it kind of breaks your heart. And that's what got me to say, I've got to do something different here, that what the tools we're using aren't working.
How did
So
you
what did you do?
motivate, how did you motivate the parents to work with you? I'm a former child adolescent therapist, so what was the magic sauce?
So thank you. The magic, well, two things. One was systemic. So the magic sauce was connecting with the guardians ad litem and the attorneys for the minor children who were pulling their hair out in terms of trying to deal with some of these parents and saying, look, the court system is just going to keep them at war. It's an adversarial process, and it's going to keep them at war. And how is that good for your client, the child? So one was talking to the systemically to the judges, and especially the attorneys for the minor children, and also the attorneys for parents who got it, because there are some attorneys who absolutely got it, and they didn't, in a sense, care who they represented. They always were paying attention to the child. So that was part A. Part B was an unrelenting focus on parents' responsibility as parents. And the fact that they happen to be married, divorced, divorcing, or never married really didn't matter because they were parents. That role had to be differentiated from their role as spouses, that you were parents. And then in that role of parents, I never called them litigants. I never called them parties. I usually didn't call them even by their first name. They were moms and dads, sometimes two dads, two moms, etc. But they were parents. And I would speak to them from the standpoint, and even say to them, what do you want your children's adult memories to be of this time? What do you want them to say when they're 30? Because what you do now is going to affect their experience of childhood. And their experience of childhood is more challenging because of what's happening in your relationship. Because even if you divorce in the most wonderful way, they now have two homes. They may have two homes in different communities. They now have the parent who's good in math. I'm not with that parent today. So what do? How do I study for my math test? I'm not good with the parent who can help me on my English paper. I'm not with them. So how can I best do that? Well, in high conflict families, it's too bad. It's Tuesday night. You're with me. So that's what happens. And the idea of saying to the parents, is that okay? And I would tell lots of stories, maintaining anonymity, of course, about kids in other families, kids who played on two different football teams in the same league, because the parents were in towns in the same league, different towns. And wouldn't you know it, the child, both teams went to the playoffs.
Mm-hmm.
So the kid was playing himself. He was playing on the red team against the blue team, and he was on both teams.
Oh, my.
So the kid is in a puddle and can't play. That was a gift from the parents. Or the kids that would say to me, my parents are liars because they stand in diagonal corners on the soccer field. And yet they tell me I'm the most important person in the family. I'm the most important thing to them. I'm not the most important. They're fight with each other because if I was most important, they'd be standing together. And they wouldn't embarrass me because I'm the only kid there whose parents are doing that. Well, that may not have been true, but that's the child's experience.
Yes.
And that's a function of where the parents are just standing and whether or not they have scowls on their face or they can just be there saying, look what our kid just kicked the ball. Isn't that great? So I
It's
would share lots of that to help reorient the parents to their responsibility to their children and their family, and that's shared. And their other issues are about divorce and their romantic relationship. That's very different. They never even had to have a romantic relationship to have a child. I said, you may not have known that, but I'm sharing that with you. And they would laugh at my silly sense of humor, but it would reorient them to the fact that they're parents first.
Did you ever have any success cases like when both parents might go to individual psychotherapy and deal with like their past and do like radical changes?
I would have to work with I would also often work with the individual therapists, and some of them were terrific. And frankly, some of them were not so terrific.
Yeah.
Because some therapists would say, you can't let the other parent get away with this. You have to be your own voice and stand up for yourself. And therefore, the parents would argue about 15-minute transition time. Should it be 6:15 or 6:30? And they wouldn't budge as if that's going to make a major difference to the child's well-being if it's 6:15 or 6:30. What makes a major difference is the conflict, is the argument about it, not whether it's 6:15 or 6:30. And sometimes the therapists and what I would call the Greek choir, Greek chorus around the parents, therapists, lawyers, friends, family members, would actually work at pulling the parents apart when I really needed them to help the parents work together on behalf of.
in the spirit of these stories, I've run into situations recently where children are just terrified by what's going on in the world. And they feel everything is different, don't know what to do. And I suspect it's the same kind of issue. You don't know where you stand and who you're with or why it's happening. It's very hard to wrap your head around it.
And for older kids, it can be even harder because the older kids have the narratives that many parents will say, family is the most important. We are all here together. And you told me that when I was 8, 9, 10, and now I'm 12 and you're getting a divorce. So what the heck was that? So even my whole foundation is turned upside down as the child. And I don't know where I stand. And now, should I be with mom or should I be with dad? And can I tell mom I had a good time at the Big E with dad? Or can I tell dad I didn't have such a good time at the Big E with him? If that's going to hurt his feelings or the other's going to hurt mom's feelings, I can't just be who I am because my world is all upside down.
It's tragic, isn't it? I mean, it's really tragic to see what people who, with the best intentions, got together and started a family how they wind up just fighting it out and hurting the person that they cherish the most because they can't get out of their own retaliatory conflict.
But when we teach them these skills and the concepts behind it, and the idea that they're opening the blinds and giving their children the ability and them the ability to see what's happening when the child's not there. If they had a daycare person that was with their child half the time and they had to have a bi-coastal job and half the time they're on the West Coast and half the time they're on the East Coast, but their child's not going back and forth, they'd want to know from that person who's a caregiver lots of information about the child, and they'd be coordinating lots of things about the child, but they can't because they divorced the child's other parent. or they
So
can.
so Jeff, is it a skill-based approach that you advocate?
Very much so. Very much so.
A little bit
In
more
fact,
about, like in a
Sure.
nutshell?
I'll often say to parents, this would get me thrown out of graduate school, but this is not really about how you feel. This is about what you do. So it's very much skills and concepts, skills at communicating, skills at making decisions, and skills at interacting in a way that reduces conflict and doesn't put kids in the middle. So, and I also, one of the things I do that's very different than what we typically do in psychotherapy is I get their releases, and after each meeting, I send a summary letter to the parents and to the attorneys on the case about what we focused on, also what decisions. I won't write legal agreements, but I will communicate what the terms are in plain English of what the parents agreed to. So they agreed that the transition time would be this time. They agreed that this would be the parenting schedule they wanted to follow, as opposed to the lawyers fighting over it or the parents fighting over it. We would come to agreement on it. It's particularly challenging for early career clinicians because you're holding a couple of things besides whatever psychological issues each parent has. You're mentioning their childhoods, Kristen, and all that brings them to today. Besides all that, if these two people are at war, I'm in a very similar position as the child is in, as the mental health professional. Because if I lean over here, even a look, a smile, or anything, this parent feels like I'm siding here. And if I do the same over here, this parent feels it.
So is that triangulation?
Yes, unlike doing couples work, I'm very much triangulated, as is the child, which is really good information for me to keep in mind.
Yeah. You're experiencing the same reenactment of the triangulation that the child is experiencing.
Absolutely.
So you can feel that in your somatic self, right? In your sensations and your physical self, that this triangulation between them. And you're an adult, so you kind of get a sense of what it's like for a little kid to be caught in that vortex of intense dynamic force.
And I see it on their faces. I see it in the parents' words and also their nonverbal communication. I see what the child sees. So when one parent says something and the other parent rolls their eyes, I don't necessarily assume that the rolling their eyes doesn't happen at home.
So I mean, what I'm hearing is the metaphor of war is accurate here, is that you are dealing with people who are at war with one another, and you're talking about like rules of engagement, like what's a good way, what is an okay way to fight and what isn't an okay way to fight, and so it is more about like skills and expectations.
I would take it one step further than that, Kristen. I'm not telling them how to fight. I'm telling them stop the asterisk, exclamation point, @ sign, ampersand sign, stop the war. Because what's ending is this marriage. And if you say to me you would donate a kidney for your kid, you get hit by a bus, you'd run into a burning building for your kid, but you won't talk to the other parent in a respectful way, in a polite, considerate way that you would talk to a stranger, you won't talk to the other parent. That's about something else. You would get hit by the bus, but don't put me in the same room.
So do you feel like that in some way, as I hear you talking, that you're taking a kind of parental role with the parents, that like the sort of that you parents are having trouble, you go to the head of the tribe, and the head of the tribe says, you guys got to stop. And do you feel like in some way there's like you're exerting a parental function in the system?
I think it's more of helping them change the narrative. From a very basic premise.
But you're also, it sounds like you're trying to ground them in the reality of their behavior very, very concretely. From what I'm hearing you say, that you're very concretely saying to them, you would give your kidney up for your kid, but you won't stand next to your ex.
Even their language, like exes and your parent. The other parent's name is not your parent. That's their functions, like your math teacher. Their
Mhm.
name's mommy or daddy or mom or dad or whatever their name is in the family. They're not exes, they're parents. Exes refers to the marriage.
Yeah.
And it's
Yes.
changing that whole
So
thing
it's
around.
differentiating, like in a way, like you're trying to differentiate the parental dyad from the
Couple.
marriage.
Correct.
Interesting.
And I'll tell you one more very quick story about parents. So one day, one of these high conflict parents comes in, and mom brings a bag of snacks, like snack chips, from she got gas and she knows that it wasn't whatever the brand was. And she brings this little bag into the office. And she looks at dad and she says, I was getting gas on my way to Dr. Z's, and I remembered you like these chips. And I saw them, so I brought them for you. So what is that bag of chips, back then, 89 cents? I don't know, $1.39, whatever the bag of chips is. And she gives him the bag of chips. This was not in session one. She gives him the bag of chips. And he says, thanks, that was very nice of you. What you would say to anybody who gave you a bag of chips that you liked. That was very nice of you. From that moment on, their whole interaction changed. And a number of sessions later, I said, something changed at some point. I didn't even recognize that that's what did it. Okay. And I said, what changed? Because I missed it. What changed? And he said, when she brought in the bag of chips, that told me I meant something and she cared and I wasn't the enemy and she didn't hate me.
Oh,
And I could stop fighting with her.
oh, wow.
A bag of chips.
Well,
I'd like
like
to say that was my
that
wisdom, but
moment of that act of kindness, right?
right.
Can melt somebody's
It melted.
hostility.
And I will often say to lawyers, when they say, if this is an easy case or a difficult case, they usually aren't correct. But after one session, I would say to them, I can tell whether I think I have a chance of being successful. And they would say, how can you tell? And I can say, if they cried. Because I would tell them in the first session, I'm going to do a lot of talking. And I tell them numerous stories to lay the rationale for the work, because they're used to couples therapists and family therapists and working in a very different way. And some of the stories tear at your heartstrings. They tear at mine. That's why I remember them. I don't have to make them up. They're real stories of real people. And if they tear up, I know their hearts aren't closed. And I know that their hearts are open. I have a shot.
So
How
I'd like to shift gears a little bit here, and one of the things that's sparking my curiosity here is I've been working on a presentation, and part of the presentation is trying to discern the difference between a technician and an expert practitioner. And you're an expert practitioner. I can hear that as you speak. How do you help people move from technical competence or technical proficiency to like the kind of expertise? Is there a, and this is what you do in the Practice Institute, I think, in some way. How do you move? What would you say about that? Like, how do you move from a technician to practitioner?
So the word that comes to mind is mentors. We often have the sense that when we graduate, when we finish our postdoc, when we're licensed in any field that we're in, and we're now legally in the state we practice told that we're able to practice. Yeah, I'll read some journals, I'll go to some conferences, I take a course, but I'm basically done. That's how it is here in the US. In Ireland, for example, my understanding is that that may not be today, but at least a number of years ago, my understanding was that throughout your entire career, in order to renew your license, you had to have ongoing mentorship. Not just take X number of hours of continuing ed, but ongoing mentorship, where you talked about cases, not supervision where there's a legal responsibility, but mentorship. I couldn't do this work and I couldn't build a practice if you don't have experts that you can talk to and that can help you get out of holes you've fallen into that are kind of deep, and perhaps also help you avoid holes that you're about to fall into. And there are colleagues that I have that we're on each other's short list, so to speak, that we can pick up the phone and call, and you know within a day or so that you will get a call. And that there are people that you can talk to, whether you pay for it or it's friend to friend, professional colleague, not a listserv. Stay away. I would say stay away from the listserv for professional guidance and advice, especially on cases. But that's really how you. And I know concert violinists that still take lessons, and opera singers that still take lessons, and probably sports figures that still take lessons, and they can beat the tennis pro that's teaching them. They can outplay the tennis pro, but they're still taking lessons because it's about growing from just being a technician to really being an artist.
And so it's really you're also saying it's being part of a continuous learning community.
Yes. It's all about
mentors and colleagues who you can call and they'll pick up the phone and you'll say, and I totally agree with you. I think that is what makes us more effective, having multiple perspectives on the cases that we're working with.
And also humility, realizing that we don't know everything, that we only know what our one brain tells us based on our own experiences and our learning, but that especially in this work, it's not as scientific as we'd like to believe, where you have an ear infection, and in 99% of the cases, if you administer this, you're going to get this result.
Yeah, absolutely.
And we're not in that, we don't have that level of science yet for this kind of work.
Dealing with uncertainty.
And knowing that I don't know makes the difference. Knowing I need to reach out, not just when I'm afraid I'm going to get sued, but well before that. And to be able to have somebody that you can talk to about cases and how you structure the case and how you deal with all the other pieces of it, especially in the divorce work, but in all work where you have challenging cases.
Yes.
So how do you, when you hear these stories, these battlefields where children are left battered because of their parents' battle, it must bring a lot of pain to you, a lot of sense that you can just imagine what it's like for this kid to go home. And how much of your experience do you share with the parents and the child?
Well, when I'm doing this work, I hardly ever see the child, except there are a couple of different models. There's something called collaborative divorce, where I would see the child as a family therapist. But I often bring the voice of the child into the room. And that's how I do it without knowing the child. So I might say, for example, the parents are arguing. We're coming up to Thanksgiving at this moment. And the parents are arguing, should the child spend morning with one parent and afternoon with the other of Thanksgiving? So at 2 o'clock or 3 o'clock, they transition to the other house.
So you stick, no matter what's going on, to how they're going to make it, how they're going to see what's going on, and how
what's the experience of the child. So I have to leave. I eat a whole big meal and leave one house early. Well, everybody's enjoying dessert, and afterwards, I get to the second house late, only to do what? Sit down and eat another whole big meal. What's that like for the child? And I had one teenager who said to me once, she said, and with all kinds of flair, she said, I don't know what my parents are talking about. Dad calls it his weekend and mom calls it her weekend. Hello? It's not their weekend. It's not 50-50 and I'm 0. I don't think so. It's 10-10 and I'm 80. It's not 5-5 and I'm 90. It's my weekend.
So you seem like you're able to channel the experience of the people that you're working with in some way and like almost reenact it in vivo with them.
Yes.
Wow.
And even if I don't, then in that case, I spoke directly to the child. But even if I don't, what's it like for your child to play on 2 football teams? What's it like when your child has you on diagonal sides of the field?
So are you
Right.
trying to stimulate through that process empathy and attunement to the child?
Yes. I'm
Okay.
trying to grow that in the parents as opposed to resentment towards each other. No, they need to be focusing on their experience, the child's experience, and somebody has to bring the voice. And if I bring it very softly, if I try using facilitative, more traditional therapeutic techniques, what might your child feel? It often doesn't work in the highest of conflict of cases because my child feels I love them, but you don't. No.
I mean, that's interesting. I mean, I think
You're
that's,
an idiot. I got this down.
oh, I think what you're talking about is fascinating. I find like today when I was doing some therapy with a new person I'm working with, I often find myself shifting into a role and assuming the role of the person that they're talking about, but they hasn't they haven't found their voice because they're feeling disloyal. And sometimes I'll say, I'm going to say some things that may or, but I'm almost like hearing voices now. And I hear you saying, and I hear a voice in my head saying, you shouldn't be talking about this. You're being disloyal. You shouldn't be. And it's most of the time it evokes intense emotion in the person. Like, how do you know that that's the way my mother or father talk to me? And like you feel it, right? You feel the energetic you're in the energetic field, and after doing this for so many years, you can just speak it.
And sometimes you can also ask a pointed question. So you're at the school play, and Bobby or Mary is up on the stage, and the school play is over, and they get off the stage. And one parent's in the back on the left, and one parent is in the front on the right.
Who do you go to first?
Who do you go to first? Right? What's the child going to ask themselves? And by the way,
you freeze and have a
mommy
panic attack.
do I go to mommy first? But what if daddy leaves? If I go to daddy first, then mommy's going to be upset because it's a mommy day. And what does it mean when you spare the child that dilemma because you did the very worse than getting hit by a bus is you sat next to each other. And if there's a sibling, you put the sibling, dare I say, in the middle in the seat. But if there's no sibling, you sit next to each other, and one of you saves the seat, and the other one waits till 3 minutes of 7 when the show's about to start, and then comes in and sits down and says hello, and then the lights go off and you don't say anything for the next hour and a half. And then when the lights come on, you walk up to the child and you say, what a great job you did. And you spare the child of that dilemma. Which way do you want your child to feel?
Mm-hmm.
So it's about being the voice of the child.
Where did this come from for you? Where is this well of empathy and perspective?
Well, my parents did not divorce.
Mhm.
There were certainly moments in my own family, but I think it came from what the kids taught me. It came from my child practice in those years and what kids taught me about the battlefield, about the soccer field, about my weekend, and many other stories that.
And so what about the drive? Like the drive to be an advocate for these children?
So that's a great question, Kristen.
Yeah.
And I think, and it also relates to the other work that I do. Jeff mentioned the Practice Institute. It comes from what I would call a vision. And it comes, we often, if you look at Psychology Today and other websites and clinicians' websites, it speaks about what they do or features of what they do or how they do it or what insurances they take or don't take. It doesn't speak to why they do it. And the why is the vision for me. And why for me is to give those asthmatic kids a better childhood. And I do it, the methodology is working with the parents, but the passion is from that vision of not sending them home to smoke-filled families. And that vision is what also can help you construct your own practice as well, in a very, like many times lawyers would say to me, would you mind doing a forensic custody evaluation? And I would say, yes, I wouldn't mind. I'm not going to do it. I'm not even going to get trained by design to do it. Well, one could argue that's a very nice parallel kind of work. No, it's not. Not if it's a vision focused. If it's vision focused, it's not at all parallel work. It's antithetical because it's work in the adversarial system promoting more adversarial divorces, as opposed to my additional training was in mediation. My additional training was in collaborative divorce.
So
Where
can I ask you, go ahead, Chris.
where do you think this a choice, like, I mean, for you came from? Like, why children? Like, why the wish for them to have the opportunity to breathe fresh air, to grow in a healthy way? Like, where does that come from for you?
I saw the pain and I connected to it. I did not feel that way in college. I did not think that in graduate school. I didn't think it early in my career, but after seeing lots of kids of divorce.
So is it like a protector side of yourself, like that you were called to
it was about wanting to be effective.
What's that?
It was about wanting to be effective.
So, Kristen, you said something that you just picked up on what I was thinking. So, what I want to ask you, it could be from what I've been reading about what's going on in medicine now, a controversial question. And what I want to ask you is following up on calling. Do you think that what we all do is a calling, or is it a job? What I've been reading about, I read something about the younger generations of physicians. There was an article in the New York Times recently about the generational difference between the early career physicians and the older ones. The older ones sometimes say to their younger ones, "This is a calling. You don't just go home at 5. We're doctors. This is," and the younger people, some of them are saying, you know, that's prejudicial, or that's not the way it is. How do you feel about the idea that what we do is a calling as opposed to a job?
I would say it's both. And I'm not just trying to hedge. I think whether you're doing this high conflict divorce or you're doing any other, Jeff, I know in your practice, you have a specialty with people with personality disorders, especially borderline personality disorders. Many people would say, I don't want to see a patient with a borderline personality disorder, as you know. I think there has to be a piece of it in order to be aligned. And we think of it as, you know, building your dream practice is having a practice that's aligned with something that's important to you.
Yeah.
Whatever reason it's important to you. And I think that's the piece that's a calling piece. You know, if you take a physician or anybody in healthcare and you have them do a different specialty, it might have failed horribly. Not that they couldn't learn the material they needed to learn, or the information or the techniques they needed to learn, but it wouldn't be at all aligned with who they are or what's important to them at that point in their lives, which can change over time. Yes. As we all develop in our own, that's right, in our own trajectory of development. But I also think we need to have boundaries. And there's I think it comes from the Buddhist literature, but you see it on Hallmark or other greeting cards here. And it says a person puts their foot in the river, and the river is never the same. And I think about all the people who we touch are like our feet in the river. The problem with that greeting card is it doesn't have the rest of the phrase, which I stumbled on many years ago. And the rest of the phrase was a person puts their foot in the river and the river is never the same, and neither is the foot. This work has an impact on us.
Yes.
Well, and if we don't have good boundaries, then it's impacting us, and it can have
Detrimental. Yeah.
effects on our own well-being, on our own relationships, on our own mood. And we have to have some boundaries. That's the job part. But yet the satisfaction, I think, comes from the calling part.
And do you think that that's what prevents burnout when we feel like what we're doing is making a difference, and we're getting like it sounds like I'm sure you get good results. And do you think that inoculates us? Like the better we get, the more we're inoculated against burnout?
I think getting good results, even sometimes because of a bag of chips.
Yeah. Well, it's creating a space.
I can't take credit for the bag of chips, but maybe I take a little bit of credit that she thought of it.
But you create a space for people.
Create a space. And I think that those moments that you say, something I did here made a difference in a positive way, that relates to the calling, that I'm doing something important. If I'm an oncologist and I'm dealing primarily with terminal patients, not all oncologists are, but if I'm dealing primarily with terminal patients in my subspecialty in oncology, it's not about patients living longer necessarily. I have to have a way of evaluating my work and the difference that I'm making in a positive way.
The quality of their life.
The quality, how I'm helping them through that process. I used to do a support group for oncology nurses, home health nurses, hospice home health nurses. And they were like angels. And one of them said, I said, how do you do this? And one of them said to me, we look at ourselves like OB nurses. We're just on the other end of the spectrum. And in OB, everybody's happy that most of the time that the baby's coming into the world. And now that baby is leaving the world. And that's often not a happy time in families. And it's harder. We're helping with that transition. We're helping with the other
meaning.
biggest.
So you say meaning.
So it has meaning.
Yes.
That's the vision piece. It has meaning. You structure it not just as I'm making widgets. How many hours did I provide of therapy? No, it's what's the meaning behind it? What's the vision, and how is that aligned with who I am?
Do you have anything to suggest for people who don't want to receive anything, who every time you try one of these things what do you think this is like for your child, or can you see what it is? And they say,
there are people that
don't do that.
I think there are people that you're not going to be successful with for whatever reason. And it may not be them, it may be us. It may also just be the fit and the chemistry. Or it may be what else is going on that's outside of our awareness with them or outside of our awareness with ourselves. And I think we have to know when that place is. So I had one person that called the mother of his children by a name that begins with an early letter of the alphabet. I'll just stop there. And I said to him, this was on a first initial phone call to me. And I said, that word's not something that we're going to be using. And he said, I'm sorry, I shouldn't have used that word. I said, I appreciate your apology. And we set up the first appointment, which was a 3-way appointment. At the end of the appointment, mom left first and dad lingered to write out his check. And he said, she's such, and he used the word again. And I said, we're done. And we're not going to have a second appointment. And I communicated to the lawyers and to the mother that I wasn't going to be working with them.
Hmm.
Because if he couldn't contain it at that moment for 1 hour, he did his best for 57 minutes. But the last 3 minutes, he fell apart. I knew that wasn't going to be somebody that I personally was going to want to work with and be comfortable with. I think you have to know when to pull the plug, when to say no to a case even before they come into the office, or when to say it's been X number of visits and I'm really just not getting anywhere. And maybe that's when I need, even before that, I need to be reaching out to my mentor and saying, I'm having a really hard time with this. I think too often we stay too long at the fair and we don't know.
Thank you.
Yeah, there's this great Kenny Rogers song called The Gambler.
Yes.
And you need to know, what does it say? You need to know
When to
when
hold
to
them,
hold them
When to
when to
fold
fold
them.
them, when
and when
to
to run
walk
away.
away, when to
Yeah.
walk away, and when to run.
Yeah. 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 I mean, I think that song is applicable to this population that you're talking about. Is, you know, for them, they actually don't know when to make those choices, right? And
Yeah.
they're kind of stuck with not understanding that sometimes you do need to let go, and sometimes you do need to run, and then sometimes you need to stay with it. And
Right. Part of
it's
the art
like
that
you're
Jeff was
teaching
talking
them
about
that.
earlier.
Yes.
That's,
Yeah.
that's part of the art.
So all four of us have been in private practice for a long time. And I'm wondering if you think, from your experience, there are certain personality types or certain individuals who are suited or not suited for being in private practice.
I don't know. Because I think, I don't know that I could make that distinction like that, because it may also depend what their practice, what niche they're in, how they're practicing. They might be better suited to do this kind of work, but not that kind of work.
The reason I ask is when I look back, I had a group practice a long time ago, and I gave it up because it was more of a headache than it was
Right.
worth. But I remember we were always looking for new associates and hiring people, and sometimes we would get someone in it, and I don't know if I could put it into traits or words, but there was definitely something about some of the clinicians that we had that it was clear they were never going to make it in private practice. And and it just seemed to me like their personality was not suited for the maybe managing the anxiety of having to get out there and to build your practice and to market yourself and to keep up with the work and to look. I mean, there's so many things that go into being a successful practitioner. And you think anyone can kind of be able to do that, or you think it's some people are best suited
I think
working
many
in it?
people can learn, and it depends what supports you have and what structures you have in place. It also depends on the culture of the practice. So I had the same thing as you did, Jeff, and I also left after 22 years and have been back. I did the Zen circle and I'm back in solo practice and loving it. But there was somebody that showed up and I asked the typical question, what are your strengths and weaknesses, at some point in the interview? And the fellow answered me and he said his strengths was he's able to keep people in treatment for long periods of time. And I don't think he could hear it, but I heard this loud explosion in my head, like that was the interview exploding. And I knew that that was somebody that was not going to be successful in my practice, because that was not culturally aligned
Yeah.
with the very foundation of how we worked, was to help people get better quickly, as quickly as we reasonably could. And that varied all over the map because they came in with different levels of problem and chronicity and acuity and what have you. But the idea of the goal being to keep them in treatment for as long a period as possible, that was not going to fly.
Oh,
He
interesting.
might be successful someplace else, but he's not going to be successful in
Well,
our.
he might be successful as a psychoanalyst.
I think we're a solo private practice. Like,
Or maybe not, because what does the community say if they're not getting better?
Yeah.
The community goes back to their PCPs and says,
They
well,
know.
he seems really nice, but nothing's changed. In fact, it
Yes.
maybe got a little bit worse because now I hate my spouse. Before I thought they just hated me, and now I hate them too. And I'm not so crazy about my parents.
Okay, so what about people who are interested in being practitioners and they may work in hospitals or outpatient settings or other kinds of institutional settings? What kind of advice would you offer people who are thinking about, maybe I want to take the leap and try it on my own?
So the first thing I would have them think about is if they wanted to try it on their own, they don't have to do it a full leap. They can take steps.
Okay.
So they can, for example, Tuesday night, rent office from a colleague or a friend who's not working in the office on Tuesday nights and start seeing a couple of patients. But if they're really thinking of making this serious and in terms of their commitment to it, whether it be half-time or full-time or something like that, I would go back to the vision question. Why do you want to do this? And what's the purpose of the practice? And if they say to provide high quality, and I ask this question all the time in the workshops I teach, and people will say, do high quality work and to earn a living. And yes, but that doesn't differentiate you from any other practice, except maybe the guy who just wants to keep people in treatment for a long time. Except for him, it doesn't differentiate.
I've seen a couple of his patients over the year.
You probably have. And because we were practicing.
He's in Connecticut.
Eyes of Hartford, right, at the same time. But it doesn't differentiate you, and it doesn't even tell you why you're in practice. So if you said to me, why do you do this difficult work of divorce? And I say, because I want to give kids better childhoods. That's my focus.
Why do you want
That's
to
your
give
purpose.
kids better childhoods? Like,
And we started to go down that path, right?
right.
And we could, and I usually, when I'm teaching this, I'll ask somebody, okay, why do you, and I'll do 3 times before I get to it, before I get to the pain point. What's the pain point? Same thing with people who work with vets, God bless them, you know, and, or trauma. But to get to that pain point, why do you want to do this? Because that then informs the decisions that you're going to make later, even the decisions about how you decorate your office, even things that we wouldn't think of as related to the work we're doing, how you schedule your clients. It informs lots of different things. Do you have a separate exit for people to walk out privately in a bricks and mortar office? Do you use a screen if you're in a virtual office? What about all the interruptions? You know, when our dog barks or the FedEx person's at the door or whatever.
Yeah.
It informs how you structure the practice. It also informs the way you work clinically by being able to say to yourself, this is my why.
What are the joys and benefits
Of private practice?
Yeah.
The joys and benefits are control in a good way, that you can determine your hours. You can
and the
determine
master of your own destiny?
you are. For pros and cons, you are. You don't have a pension plan except what you fund over the years.
Yes.
But you also don't have an administrator who's above you that's telling you to do things that you don't like. And then you have to choose, well, do I keep working for this person or do I leave?
Yeah.
And you're not going to get laid off because they closed your special niche. You know, you do cardiac rehabilitation and the hospital decides, no, we're just going to see cardiac patients, but we're not going to continue the rehab program. So you're gone as the mental health professional. And you're like, but.
What about a big issue for people going to practice is being on provider panels or not? What would you say to people about that?
I would say it's a mixed bag. You're on the provider panel, you often get volume at low revenue, low reimbursement rates, and headaches. You're off the panel, then you may not get the same level of volume, but you're getting paid more per unit of service. Many people will think that if you're off the panel, you can't do work that's socially responsible in your community. And I take a lot of exception to that. You absolutely can. In fact, there are practices that budget accordingly. They don't work on intuition about money. They budget accordingly, and they see the executives in the high-rise office buildings, and they see the community members that work in the projects just blocks away from the high-rise office buildings. And the people that work, and they don't take insurance. The practice doesn't take insurance. And people that work that live in the projects that they're more financially challenged, they will say to them, what can you afford to pay? And then the person says, I can afford to pay this. They say, okay. And they're able to do that because they've budgeted accordingly. And they've got so many full fee patients, roughly. They know that they've got this many people at about 80% of their full fee, 50%, 25% of their full fee, completely pro bono, which is usually not very many. And they're being very socially responsible. And it doesn't matter if you have insurance or not, I'll see you anyway.
I like that.
So that's one of the benefits, by the way, of being in your own practice, is you can make that decision. You don't have to clear it with anybody. And nobody's going to say to you, but you're not being productive enough. Yes, I am, because that's important to me. It's not all about the money. So private practitioners get a bad rap about that, and that's unjust. You can absolutely be socially responsible and committed to the community that you serve and be in independent practice. And you can also do things that are innovative. You can do things that are creative. You can change a delivery model. You can do work actually in the community because you're building a paraprofessional training program for people in the community to handle a problem that's prevalent in the community. And you're involved in that. You're getting some reimbursement for your time or not. And you're actually doing something that's good for the community, helping the community. And you're able to do that without having to get permission from the hospital, the mental health center, whoever else you work for.
This is a
coursework because I didn't have to get permission to change the model. And I could just do it. You have to make sure you're trained and you have this, and you're within your scope of practice and all the ethical and regulatory stuff that you've got that. But you don't have to go through layers of bureaucracy.
You get a special dessert also, it seems to me, from watching this. You are interacting with people in a very intense way. You're not trying to get them to respond to it, but you clearly have a lot of feeling for the different people involved that you see. And do they seem to connect to that? Do they say anything about it?
I think they connect to the passion. I also think they connect to optimism. And there was a judge in Connecticut that at open court said, Dr. Zimmerman is one of the most optimistic people I've ever met. Because I have the faith, I have the optimism that people can change their behavior. They may not be superstars. They may not be going from high conflict to, taking vacations together in Disneyland with the child. They may not go from that extreme to the other extreme, but they may be able to give the child a better childhood by taking it one or two steps forward. And I like to say, if you're responsible for only 20% because the other parent's responsible for 80% of the problem, and I turn to the other parent and I say, but really, you're responsible for only 20. They're responsible for the 80, and they're smiling because they see what I'm doing. And then I say, now imagine if instead of your 20%, you only improved 10% or 15%, and you only improved 10 or 15%. That's 30%. What difference does that make for your child?
Yeah. Well, one of the things that's so obvious, Jeff, and I know about you is your ability to engage people and your passion for the work. It just comes right through, and it's really a delight. And on that note, we're going to have to wrap up for this evening. So thank you so much, Dr. Jeff Zimmerman, for sharing your wisdom, your expertise, and your passion with us. We hope you come back again in the future. There's so much more we'd like to talk with you about, but thank you so much for your time.
Well, thank you. And I would love to come back in the future whenever the time is right for us all.
Thank you.
Sounds great. Sounds great.